when you were talking at that event, you talked about access and excellence.
Yeah.
And that really hit me. Can you just sort of explain what you meant by that?
Yeah, I mean, I think so many places in healthcare decide if they're going to be aimed at access or they're going to be aimed at excellence. Like if you think of the hospital you go to, the hospitals that others, the doctors they go to, you're either someone who's saying like, I take all comers, I'm going to always be there, or you have someone who says, well, only the elite get in here, and we're going to show that we do the best at the top, and we're going to advertise, the celebrity, the pro athletes that we take care of. And so health systems, doctors, departments, they're all aimed at that. And I firmly believe that the future of medicine is to not see those as competing interests. I think everything is, you can provide access and excellence, and you can actually make one kind of play into the other and support the other.
How so?
A lot of science, when you look at what's studied, super interesting. Like you look at a study that dictates, a new medication comes out, right? They ran a clinical trial, and historically they would run that clinical trial, and they would run it usually only through what's called an excellence hospital, right? A high-end hospital that caters generally to affluent white men, right? And they ran a clinical trial that showed that a drug worked for affluent white men, right? And they didn't run a clinical trial that was gender equal, that was diverse, that showed, and we know that genetically some of these medications work better in some than others. You need to have access points for all type of people, old, young, every different kind of look, nationality, gender, everything. To say that your care works, it needs to transcend the differences in people. It's just a fundamental principle.